So what is the Delta variant, and why is there so much concern with this particular variant of the COVID-19 virus?
The Delta variant is just a new version of coronavirus that's mutated, and it has become much more transmissible than the original agent of COVID-19. We think the Delta variant is 2 times as likely to spread from person to person. It's just as deadly, we think, and so the problem is that you're going to get that many more cases, and it can reach that much more quickly to vulnerable people and lead to increasing hospitalizations and death rates like we're seeing in many areas around the country and around the world.
So let's get into a few scenarios. First, just me personally, I've chosen to be vaccinated. I did that months ago as soon as I was eligible. My kids have been vaccinated, most of my family, my friends. But let's say I'm one of those people who has chosen not to get vaccinated. Maybe I'm younger, maybe I'm in good health, maybe I made it through the first surge fine, and for whatever reasons, maybe I'm not comfortable with the vaccine, or I think that herd immunity is somehow going to protect me. What would you say to those types of scenarios, or what's the risk there?
The Delta variant makes me most worried about people who are unvaccinated. Across the United States, we've seen a surge in the number of cases and in hospitalizations and in deaths. And the vast majority, more than 90% of the people who have been hospitalized and otherwise had severe disease from the Delta variant have been people who are unvaccinated. It's really clear that the vaccine does provide protection from the Delta variant. So the people who are really getting hurt are unvaccinated people. It's also true that the Delta variant is occasionally causing breakthrough infections in people who are vaccinated, and it looks like it can probably be transmitted by people who are vaccinated. But that's neither of those is quite as scary to me as the huge risk to people who are not vaccinated. That's who's ending up in our ICUs.
Can you explain a little bit about how that breakthrough works? Because I've heard that a lot, that this is going to be a pandemic of the unvaccinated. And a few of my more skeptical friends ask me, well, if people are getting sick who are vaccinated, what's the point of that? Why even risk getting a vaccine that I don't trust? What would you say to that?
It's a good question, and it kind of comes down to severity of disease. So if you look, the vaccines across the board offer great protection from the Delta variant. And that protection is not perfect, though. And so people can get infected but be totally asymptomatic, or maybe have a mild cold if they've been vaccinated. The contrast is, and in rare cases, people who have been vaccinated can get sicker from the Delta variant. That's typically in somebody who's quite old or immune compromised and maybe didn't mount a great vaccine response. But in most cases, people who are vaccinated are getting mild disease, if anything. That's different with people who are not vaccinated. That's who's getting hospitalized. That's who's in the ICU. That is who's dying. So those skeptics need to look at the numbers and realize that these are life-saving vaccines, and poo-pooing saving of lives makes no sense.
Okay, great. Thank you. We've got a quick question from Brandy on Facebook. I think this is in response to your first comments. So the Delta variant is more dangerous because it spreads more and is more easily contagious. Is that the gist?
Yeah, that's the way to think of it. You can imagine if you have 100 people who get infected, a certain small percentage of those people are going to get really sick. That percentage of people who get really sick is double if it's 200 people who get sick, and triple if it's 300. Since the Delta variant can reach so many people so much more quickly, it causes more severe disease just through brute numbers.
I see. This reminds me of something we spoke about earlier. How small of a contact does it take to spread Delta? I've heard it described that just walking by someone for an instant, Delta can spread that way.
Yeah, that's right. I mean, we know that the original version of SARS-CoV-2 usually takes some time to transmit. That there are examples of people who had very glancing contacts, that person who was 30 feet away in a restaurant for just a few minutes. So that did happen with the alpha variant, but generally speaking, you had to be in the room for a little bit longer. There are some alarming reports of increasing numbers of people whose transmission resulted from incredibly brief and slight contact with somebody. And it looked like the Delta variant's increased transmissibility was to explain for that. We see that people who have the Delta variant have much more virus in their respiratory tract. And so it's probably just that much easier for each breath, for each sneeze to spread the virus to somebody else nearby.
Wow. Okay. We've got another follow-up question from Facebook from Rebecca. Can't you just take ivermectin if you get COVID?
We've actually got really high quality studies coming out suggesting that ivermectin is not beneficial in the prevention or treatment of COVID. It's one of the things that there was a lot of sort of internet chatter about, but the really good quality clinical trials have shown no signal.
Okay, thank you. Another question from Nancy on Facebook. My 21-year-old had COVID in February 2021. He was fine, just lost his taste, his sense of taste and smell for about 2 days. He did not get the vaccine. Can he still become infected now?
Yeah, so we know that being infected with SARS-CoV-2 itself can confer some protection from getting it again. We think that it's partial protection. A recent study was suggesting that there was about 75% protection from a future infection if you'd been infected, by the virus itself, as compared to from the mRNA vaccines. In that same study was closer to 85-90%. So it looked like the vaccine was better at protection. One of the big unknowns is that each of those things probably varies over time. And we don't know, because it's so early in the pandemic, how long does protection last after getting the infection versus how long does infection last after getting the vaccine. So that's being actively studied right now. What we know is that people who got infected by the virus, but then got the vaccine, appear to have better immune responses. And there's some hints that they might have additional protection, although the data on that is much less strong than people who have never been infected and got the vaccine. So what I most care about is people who have never been infected get the vaccine. Most people who have been infected don't know. So I'd say get the vaccine. It's safe to get if you've been prior infected, and it might give you extra protection. We're just not quite as sure as for people who haven't been infected. The quality of the evidence isn't quite as high.
So to boil that down, even if you have some protection with an infection, you're getting a much higher level of protection and a much more predictable level of protection when you get vaccinated.
Yeah, the way to think about it is, for most people, if they were going to choose get protection via having infection versus get protection from getting the vaccine, no brainer, right? Like, you don't want the risk of long COVID, the risk of, being out of work, the risk of a very bad thing happening, including death from infection. And so pick the vaccine, of course. Let's say you know for sure that you had it, meaning a doctor did a test and it was positive. Do you have some protection on the basis of that alone? Yeah, probably. Is it complete? Definitely not. Could a vaccine make it better? We think it might.
Okay. Another question from Facebook from Jamie. I heard that the risk is less than 0.1% that a fully vaccinated person could transmit COVID. Is this true?
That's a, well, how do you say this? It's a complicated thing. We know that getting a vaccine protects people from transmission. The best estimates of how much it protects people from transmission are complicated, because it kind of has to do with like how exposed they are and all that, and how many other people around them are vaccinated. But we think that it's probably 80-90% protective against even getting infected, and therefore so you can't transmit. Not that they can't transmit at all, it's just unlikely. We also think that might be changing with the Delta variant. This has been a driver of recent changes in the CDC guidance, is that there's some data coming out of Israel of chains of transmission of vaccinated person to vaccinated person to vaccinated person transmitting Delta variant. So they're still protected from severe disease, but might that virus still leap from person to person to person despite vaccination? It's looking like that's the case. So that's part of why the recommendations are changing.
So would that also bolster arguments for why it sounds like the Delta variant got a foothold in a lot of communities through unvaccinated folks, and that's stressing an otherwise more protected population. Does that sound about right?
Yeah, the way to think of it is that the way the virus mutates is that it copies itself. Every time the virus makes a new copy of itself inside somebody's body, it has a chance for its copying mechanism to make a genetic error. That's how it mutates. And sometimes it can become the Delta variant or some other variant. So the less we have transmission, the more we either wear masks or when appropriate, or we get vaccinated, the less mutation the virus can do and the less it can escape our immune systems or escape a drug or escape a vaccine. So that's why scientists really want to lock the virus down so that we can get back to our lives and not have some new variant that makes the vaccines not work as well, for instance.
I'm going to switch gears a little bit for Allison, who asks, can you talk about the risk of Delta to children who aren't old enough to be vaccinated yet? And I know that's something that's been, that's it sounds like who's being impacted the most right now is a much younger age group versus the first waves that we saw.
Yeah, this is a big question, and I think there are some question marks still left, but I can give you a sense of the state of the art. So some background. So it turns out if you look now at who's getting really sick from the Delta variant, it's younger people. The average age of people who are in the hospital or otherwise getting severe disease is lower. And that makes sense because a much greater percentage of our elderly population is vaccinated. And so they have more protection than, say, people in their 30s. Children in general through this pandemic have been much less likely to get really severe disease. And them, it's more often a cold or asymptomatic. And that remains true of the Delta variant. What's also true is that the more transmissible Delta variant can infect many more kids. And so even if you have like this really small percentage of kids who get long COVID or severe disease, perhaps because they're medically frail, if you get lots and lots and lots of kids infected with Delta variant, then they're vulnerable to having that thing happen. And of course, nobody wants the kid with difficult to treat diabetes or the kid who had leukemia to, end up in the hospital. Nobody wants that. And so partly we're trying to protect that kid through vaccination. A challenge in young kids under 12 is that there is no indicated vaccine for them yet. Those studies are still happening and we don't know yet if they should be vaccinated. That means that the way we protect them is by getting the people who can get vaccinated so that they're surrounded with a wall of vaccinated adults and teenagers who protect them from getting infected. That, I think, is the most important way we keep young kids in school and able to learn and able to have social experiences, even though they can't be vaccinated.
Okay, great. So that leads me to another question, which I'm going to broaden. Jana asks, any advice for families with children too young to be vaccinated? But I'm gonna dovetail that into just in general, what tips could you give for staying safe right now if you're a family with maybe children who can't be vaccinated, all the way up to, if you have been vaccinated, it sounds like Delta is just a lot more aggressive. What things should we be doing right now that could keep us safe?
It's a great question. And I think the answer is different from place to place around the country. So since the best protection for young kids from the Delta variant is vaccination of the people who can be vaccinated. Right now, the important thing is to increase our population level vaccination rate. The reason why it's better to be a kid in Vermont today than it is in Florida, for instance, or Missouri, is that our population vaccination rates are among the best in the world. So that is protection for our kids, and the more of us that do it, the better.
Okay,
I think a lot of people have questions about, well, should they be doing extra things? Should they be back to wearing masks in the grocery store or otherwise taking extra precautions? I don't think that that's absolutely necessary right now. I go to the grocery store without a mask on, and I think that's still a reasonable thing for people to do if they're not like especially medically vulnerable. It's possible if the case rates in our area go up that we may need to go that extra distance to be able to protect kids. But the hope is that so many people will be vaccinated that transmission will be sort of stalled out so that it doesn't reach the kids. The only way to know, I think, is to watch the numbers. If our case rates skyrocket, particularly as kids get back into school, then we have to adjust like we have for the last couple of years, just looking at the data, changing the plan if the data changes.
Okay, great. I have a great question from Facebook from Rebecca again. She says she hasn't gotten the vaccine yet and is on the fence. Her comment, "The shot scares me." She's heard about deaths and severe reactions. Is it worth the risk? And I get this all the time, but I would love to hear your thoughts about that in particular.
Yeah, it's a great question. And I think it's good for people to approach the question that way. What's in the pros column for getting a vaccine? What's in the cons column? And I think one of the challenges is it's hard to compare those pros and cons because they're sort of different things. So here's how I think about it. In the pros for the vaccine, there's protection from death, and these deaths are common. So 612,000 Americans have died, and there have been 4 million global deaths. And we think the deaths in areas like India and sub-Saharan Africa are massively undercounted. So that's a huge death toll that vaccines reduce dramatically. So in Vermont, our death rates have just plummeted from vaccination. There are side effects of vaccines. They're quite rare, but they happen. So many people, like I did, have an uncomfortable day after a vaccine, but it's no big deal. I took some ibuprofen, I took a nap, and I was fine. But it is true that rare side effects happen, and there have been news reports of clotting with one of the vaccines or Guillain-Barré with another one, myocarditis in young adolescent boys with another. But it's really important to point out that those are extremely rare side effects. A few hundred of this, a handful of that. So in balance, I say, do I wish that vaccines had zero side effects? Absolutely. But how do they compare to cholesterol medicines and blood pressure medicines and other things? Incredibly safe. So when I got vaccinated, when my wife got vaccinated, when my 22 and 17-year-old sons got vaccinated, I lost no winks of sleep worrying about their safety. In fact, I felt relieved because they were safe.
How many vaccines worldwide at this point have been administered?
Yeah, that's a really important thing when you're thinking about the safety of the vaccines. I think one thing that I hear from my patients is they're wondering if the vaccine is new and whether that means that they should wait till people know more about it. The thing I clarify for them is that certainly when something's new, you can find out something new later, but you have to think that these vaccines have been given to 4 billion people this year under the most intense global scrutiny any vaccines have ever received. So we know a lot about this vaccine. I have a hard time keeping up with all the papers that are coming out so quickly. Incredible scrutiny. As you may have seen the public, CDC tribunals that they held to evaluate each vaccine that was recommended in the United States. So we know a huge amount about these, and that's what's so reassuring to me. The published, the publicly discussed, the actively Twitter debated stuff, it's out there and really good.
Okay. Another question about Kids from Hope on Facebook. What are your suggestions for families with children that are too young to get vaccinated but want to travel? Should we hold off?
Yeah, that's a great question. It gets into those gray areas of like, how far would you push? So I think the answer to the question depends a little bit on where are you traveling to and your medical risks and your risk aversion. So I'll try to boil it down, but I think as with lots of things in COVID, there's no one simple answer. So where you travel makes a big difference. You know, if you're going to someplace in New England, for instance, where case rates are pretty low and vaccination coverage is really good, that's going to be safer than going someplace like Florida, where the vaccination rates are pretty bad. That matters because you can kind of think of the vaccine that you've received as a goalie, a soccer goalie. And so it's a great goalie. It protects lots of the goals from happening, but it's not perfect. So if you have one case you're exposed to, a couple, that's a couple, forwards taking shots on the goal. What if you were in a place like Florida where you might be surrounded by lots and lots of cases? That's a whole bunch of people kicking balls at the goal, and the goalie could get tired or just not be able to protect you from all of them. Some people are a little less likely to get protection from the vaccine if somebody is immune compromised, for instance. That can do it. Kids are at risk because they can't be vaccinated under the age of 12, but generally at pretty low medical risk if they're healthy. But let's say the kid had bad lung disease or immune compromise. That's something to take into account. I think the other piece has to do with risk aversion. So, I go to the grocery store and I don't wear a mask, and that's because I'm vaccinated and I don't have a reason not to respond to the vaccine. And also, although I know the vaccine's not perfect, I'm willing to take that low risk because I really want to get that normal life back. Some people either have medical illnesses that makes them wear a mask or otherwise take precautions, or they're just really risk averse. That small risk of infection is not a risk they want to take. So I think you can factor that into this too. For me, I would travel for something important. I'm looking forward to seeing my parents in Utah for the first time in a long time next week. I know there's a little bit of risk with that. I'm going to mitigate it by wearing a mask, and I'm willing to take that risk. If it was a not important trip to some place where there are lots of infections, I might wait for a little bit. But maybe I'm a little bit less risk averse, maybe I'd do it. I think it's in that gray area that you can feel out as a person and as a family.
Next question from Walter. This one about testing. How is UVM Medical Center testing for Delta with the new change in PCR?
It's a good question. So it turns out that the usual clinical tests do not tell which variant virus is causing somebody's infection. They just say that SARS-CoV, the agent of COVID-19, is there. Public health labs and other labs can do a special test that looks to see if it's the variant. That is being monitored in Vermont. And so if you look on the Vermont COVID-19 dashboard, you can see that for the previous month, the Delta variant, like around the country, is overwhelming the other variants in our area too. So that's being monitored in a sort of a small subset of infections, just so we get a sense of what's circulating in the area. And public health facilities all around the country and around the world are going to continue to do that because we are watching to see what comes next after Delta and Lambda and the other ones.
We're getting a couple questions about J&J versus the two other COVID-19 vaccines, Pfizer and Moderna. Should those of us who got the J&J shot be thinking differently about risk and precaution right now? Should we be thinking about travel or anything else differently if we got Pfizer or Moderna, especially if we're going to areas where there's lower vaccination rates and increasing cases?
J&J, like Pfizer and Moderna, offers good protection from the Delta variant. We've shown very high levels of protection from severe illness, most importantly. We think that the J&J vaccine is a little bit less likely to protect people from mild disease than the two mRNA vaccines. That's been known for a little bit, but the things you really care about, protection from hospitalization and death, it's excellent, as good as they are.
Great.
It's been an open question since the immune responses to the mRNA vaccines are a little bit bigger, and since protection from mild and asymptomatic disease a little bit better if maybe people with J&J who got J&J should get like a booster with one of the mRNA vaccines. And there's some basic sciencey findings that made people interested in that. And so that's being studied, but it's not something that's been proven to protect people from clinical disease. And so right now, that could just be a test tube phenomenon that doesn't lead to protection, or these studies could find that it actually is a way to boost protection. So I think we'll find out in the coming months, but right now, I'd say rest easy, you have protection from severe disease, and you should have the same mobility and flexibility of life as the other people.
So that segues nicely into another question from Walter on Facebook. When do you expect us to need boosters? And I know there's been a little talk about that recently, even this week, that they're starting to see enough trends in the data that they think they know they're getting a handle on when a booster might be appropriate.
Yeah, this is something that the data are evolving rapidly around, inevitably, whenever the data is moving quickly, you're going to hear slightly different stories from different people. Maybe it's just because they're speaking to slightly different days in the evolution of the data, and also different people have different opinions. But here's how I look at it. We do not know if a booster vaccine makes people safer from disease. This has not been proven yet. We do know that booster vaccines can boost your immune response, but those test tube findings have not yet been related to true protection from disease. Those studies are being done, and I anticipate the results are going to be out fairly soon. And so if I see that boosting the vaccine gives you better protection, then maybe we'll be excited about doing it. But for right now, I'm not excited about doing it. I wouldn't recommend it until I see better evidence. Also, I think there's going to be a really big, let's say they do show evidence that my mRNA vaccine that I got could have even better protection if it was boosted. I think there'll be a very big international policy discussion about whether that's a good use of finite vaccine supplies. There are many countries in Africa that have fewer than 5% of their population vaccinated. And so it's way, way lower than what US and some of the other wealthy nations have. If we have just one dose of the vaccine, should we use it to get somebody from zero protection to 80, 90% protection? Or should we use it for somebody else in a wealthy country to go from 80, 90% to 90, 95? I know what I would choose, and I would say, let's get people at least their first shot first and then go to the boosting. But for now, that's all academic. We don't know if the booster is needed. We'll find out soon.
Okay. Another question, a couple questions actually now about masking in schools. It sounds like, well, first somebody, Hannah on Facebook asked, do you think masks should be mandated this upcoming school year? I believe that's happened. But there was a second question we got that considering mask guidance for schools, the governor hasn't really done that for the general population yet, and why the difference?
Yeah, so this has been a confusing couple of weeks because the messaging has really had to change. And the messaging has been different in Vermont compared to US messaging. And so I can clarify why that is. It turns out that before the Delta variant swept across the globe and rapidly replaced the original variants, that the efficacy of the vaccines was so good and the infection and especially death and hospitalization rates were dropping so fast that nobody thought that we would need to have vaccines. But being responsible scientists and doctors and nurses, we kept an eye on the data. And then Delta happened, and you could see infection and hospitalization and death rates rise.
I think when you said vaccines, you meant masks?
Oh, sorry, mass and vaccines. That it was all sort of keeping the virus under control. But then we started to see, the rates of infection and hospitalizations and deaths go up in response to the Delta variant, mostly in the unvaccinated people, but probably with some transmission among the vaccinated, mild disease in them. And so that's what drove the CDC to switch their guidance and say, well, wait a second, we thought we wouldn't have to use the mask, but we're starting to see signs we might have to. One thing that tipped them over the edge is that they have some data that are about to be released showing that people who are vaccinated even can transmit it, like I talked about earlier on in this Facebook Live. And so that's leading the national guidance to be changed, and included in that has been the requirement that school kids above a certain age wear masks. Nobody's excited about that because we all know that that sort of makes it so that social interactions are hard and it can be uncomfortable, and we're all sick of masks. It's also doable for kids, and I think we were all a bit surprised at how well kids above a certain age did with masks, but nobody wants to do it. Naturally, though, I think it makes sense to ask whether the local epidemiology suggests that that's necessary. And I think in the parts of the country that are unusually well vaccinated may have a different story to face. In Vermont, we have seen an uptick in cases. We have really not seen a big uptick in hospitalization and deaths. So in the UVM Health Network, there have been 1 or 2 or 3 cases in the entire health network of people hospitalized with COVID, nobody in the ICU for the last while. So in response to that different reality, where it's much better in Vermont than it is on average around the country, Governor Scott and Commissioner Levine are thinking, well, maybe that national guidance doesn't apply exactly to unusually epidemiologically good Vermont. And so I think correctly, they're waiting to see if things change. And it may be that we're just going to have to say, you know what, in places where the numbers look great, here's the guidance. In places where the numbers don't look great, here's different guidance. That makes common sense to me.
Okay, great. PJ on Facebook asks a question that I think we covered, but I want to hit this again because it seems like it causes a lot of confusion, especially for people who are on the fence about getting vaccinated or not. They ask, are we seeing cases of people who are vaccinated getting infected with the variant? That's true in rare circumstances, but you had mentioned the big difference there is the severity of the illness they might get is much, much safer than without.
Yeah, super important point is that we are seeing large numbers of people end up in the hospital and dying from the Delta variant who are not vaccinated. So it's incredibly dangerous to people who are not vaccinated. We are seeing some cases, a small number of cases in people who are vaccinated. Those cases are overwhelmingly asymptomatic or mild. It is really uncommon to end up in the hospital or dying from the Delta variant if you're vaccinated. And in the vast majority of people who have had severe disease like that, despite vaccination, they're immunocompromised or otherwise frail in some way that explains why their response was not as good as the average person. So vaccine is absolutely protective from death and hospitalization and other bad forms of COVID-19, including from the Delta variant. It's just not absolutely perfect.
You'll also find resources in the comments here, including a Q&A with Dr. Leahy that covers a lot of the same topics that we talked about tonight, as well as how to find and schedule a COVID-19 vaccine if you haven't yet and you've decided that that's something you want. I certainly hope you do. And thanks again for joining us. Dr. Leahy, thank you so much for taking the time tonight to talk.
You're welcome, Ryan. And maybe just a quick comment, which is Vermont gets a lot of press for being the best in the nation for vaccination and also for its disease rates. There's another reason why Vermont, I think, should be getting a lot of press, and that's because instead of polarizing and dividing and yelling at each other, for the most part, we're coming together like communities should come together and helping each other out through the uncertainty and the worry and even the disagreements that we're hearing. And I'm really proud of that.
Yeah, agreed. All right. Thank you so much, Dr. Leahy. Thank you all, and we'll see you next time.